Good morning. It's another Wellness Wednesday, and it's your lady Lily, and I'm here to bring you another wellness fact. Today, we're going to be talking about the reproductive rights and healthcare for our youth. So, I want you to stay tuned. I'm going to be having a presentation. Just stay tuned and learn some of the resources and some information that might be useful. Sometimes we can solve a bigger problem by handling it early and giving people right to taking care of themselves, especially their health. Have an amazing life and stay well. That is, the reproductive education in Canada schools can vary significantly based on regional policies and curriculum decisions. Some provinces and territories have implemented comprehensive sex education programs that cover a wide range of topics, including anatomy, reproductive health, contraception, sexually transmitted infections, STIs, consent, and healthy relationships. These programs aim to provide students with accurate, age-appropriate, and non-judgmental information about their sexual and reproductive health. However, some regions have faced oppositions from certain groups advocating for abstinence only or minimal sex education. These approaches can leave students inadequately informed about their reproductive health and may contribute to the lack of awareness among pregnant youth about their options and rights. Reproductive so, in healthcare institutions, the quality and accessibility of reproductive education and counseling can also vary. Some healthcare providers may prioritize providing comprehensive and inclusive reproductive education, offering information on contraception, abortion, prenatal care, and post abortion care. Among other topics, they may also emphasize the importance of informed consent and respect the autonomy of pregnant youth in making decisions about their reproductive health. However, factors such as location, resources, and provider biases can influence the availability and quality of reproductive education in healthcare settings. Lack of comprehensive education in these environments may lead to information gaps and hinder the ability of pregnant youth to make fully informed decisions. The importance of comprehensive sex education. Comprehensive sex education plays a crucial role in empowering pregnant youth to make informed decisions about their reproductive health in the following ways. One, knowledge and awareness. Comprehensive sex education equips young individuals with accurate information about reproductive health, including contraception, pregnancy options, and STIs prevention. This knowledge empowers them to make informed choices and reduces the likelihood of unintended pregnancies. Understanding rights
care, leading to delays in obtaining the services they need. Stigma and judgment. Abortion remains a stigmatized topic in many societies, which can create feelings of shame, guilt, and isolation for pregnant youth. Fear of judgment from peers, family, or community members may lead to secrecy and reluctance to seek support. Legal restrictions. Legal requirements such as parental consent or mandatory waiting period
appropriate support and care. Youth's right to choose. Pregnant minors have fundamental rights to privacy and autonomy. Advocates of the youth rights to choose without parent involvement argue that young individuals, partially these are vulnerable or are in vulnerable or abusive situation, should have the right to access confidential healthcare services, including abortions, for their well-being. Impact on pregnant women. I can never pronounce this word right. Implementation of parental consent and notification laws can have a diverse impact on pregnant youth. Positive impact for some pregnant minors with supportive and understanding families involve their parents might lead to more informed and caring decisions making process. Negative impacts, pregnant minors who fear a face of potential harm, abuse, abandonment of their parents find out about their pregnancy might feel more compelled to resort to dangerous or illegal methods of abortion. Ethnical
youth from marginalized communities where conservative attitude or religious belief may heighten societal pressure and condemnation. Lack of comprehensive sex education, insufficient or inadequate sexual health education in schools may contribute to misinformation and misunderstanding about reproductive rights and abortion. Without accurate information about their options, some pregnant youth may feel uninformed or powerless when considering their choices, leading to delays in seeking timely care.
Exactly.
Discrimination and systematic bias. Pregnant youth from marginalized communities such as indigenous, racial, or ethnic minority group, LGBTQ plus individuals, and those with disabilities may experience systematic bias and discrimination when accessing reproductive health care, negative attitudes from healthcare providers, or a lack of culturally sensitive and inclusive care can deter these individuals from seeking abortion services or prevent them from receiving equitable care.
Eliminating discrimination and barriers towards special needs students in Canadian educational settings require comprehensive and collaborative efforts. Educators play a crucial role in recognizing and confronting barriers within themselves and the educational system, providing professional development opportunity